Leukemia is a general term for different types of blood cancer. Blood cancer can be acute, it can be chronic. Acute means rapidly progressing blood cancer and chronic means it is slow growing cancer. The acute leukemia can be divided into acute lymphoblastic leukemia and it can be acute myeloid leukemia. This depends upon the type of white blood cells involved in the leukemia. Acute myeloid leukemia can occur at any age, but the chance of getting acute myeloid leukemia increases with age. The cause of acute myeloid leukemia is not known in majority of patients, but this is not a contagious disease. You can get acute myeloid leukemia after previous history of any chemotherapy or radiation treatment, but you cannot get acute myeloid leukemia from someone else. The various signs of symptoms of acute myeloid leukemia are fever, shortness of breath, fatigue, bleeding, and having black or blue spots on the skin. For diagnosis of acute myeloid leukemia, we need a battery of tests like blood investigation and bone marrow investigation. In the blood and bone marrow, we have to find various acute myeloid leukemia cancer cells which are known as blasts. Usually in acute myeloid leukemia, the number of blasts is more than 20%. For subtyping of acute myeloid leukemia, other investigation required such as flow cytometry or immunophenotyping. For risk stratification of acute myeloid leukemia, cytogenetics and molecular investigation are required. The goal of the treatment in acute myeloid leukemia to cure the disease. Treatment of acute myeloid leukemia depending upon the age of the patient and general health. The patients which are fit, they require induction chemotherapy. In unfit patients, low dose chemotherapy is given. In the induction chemotherapy, this is a combination of chemotherapy drugs. Patient need hospitalization or about 4 weeks, and the aim of induction chemotherapy is to kill the AML cells as many as possible and to get the blood counts to normal. When there is no signs of acute myeloid leukemia in blood and bone marrow, this is called a remission. After getting a remission, patient need post-remission therapy, which may be a chemotherapy and which may be a stem cell transplantation. This depends upon the risk category of the patient. The patient in good risk category and some patient in intermediate risk category, they require chemotherapy. But patient in high risk category and some patient in intermediate risk category, they will require stem cell transplantation. There are various side effects of the chemotherapy like drop in blood counts, so patient will require multiple units of blood transfusion, platelet transfusion. Other side effect is the infections. So infections, patient will require multiple antibiotics and antifungal drugs. Other side effects like mouth sores, diarrhea, hair loss, nausea and vomiting. So once patient has completed all the treatment, induction chemotherapy and consolidation treatment, patient will require long-term monitoring. In the long-term monitoring, we have to find various side effects of the treatment and to find out the relapse. Relapse means that this disease can come back. After achieving complete remission, after getting induction chemotherapy and consolidation treatment, patient will require long-term monitoring. In the long-term monitoring, we have to find out the various side effects of treatment and to check the relapse of the disease. Relapse means that this disease can come back. Our long-term vision is that most people of acute myeloid leukemia will be cured and patient will have a good quality of life.